Today I'm in Bluffton, where life really is better, especially if you have some aches or pains that you would like to take care of, because right here in Bluffton is Indiana Physical Therapy, and I'm here with Andy Vogel, one of the owners of IPT. Andy, give us a little bit of the history. How long has IPT been around?
Well, we started in Bluffton in 1988 and shortly expanded a few years later up into Fort Wayne. And since that time, we've developed into 5 clinics in Fort Wayne, and we also have 1 clinic in Auburn, Angola, and New Haven.
So clearly you strive for patient convenience. Why is that so important to you guys?
Well, despite their injuries or pain or whatever problems that they come to us for, they still have a life to get along with. So we want to try to be as convenient in a location as well as time for our patients. We're open early in the morning and late at night, Monday through Friday, so that we can try to accommodate their schedules.
Now, what type of patients do you generally treat?
Oh, we treat all age ranges. We see school-age kids, we see senior citizens, we see workman's compensation injuries, the weekend athlete, the weekend warrior, and we generally treat all body parts, really, orthopedic in nature, people who have had any type of an injury or disease process, or even post-operative situations. And we generally see probably half of our patient population is either back or neck related, but we also see shoulders, ankles, knees, hips, knees, and ankles, all the periphery joints as well.
So what is the treatment generally like? What might one expect?
Each one's obviously, individualized to the patient and to the problem. A therapist will do a thorough evaluation and assessment, and then based on that assessment and evaluation, then we'll try to structure their program to include, it's going to generally include some kind of manual therapy where we're working with them with our hands, either soft tissue massage, joint mobilizations, stretching, and of course everybody's going to have to do some strengthening too, because it's going to be weak, so they're going to have to do something.
So I'm assuming that based on the injury, that is what dictates how long the treatment might take.
It does. It does. General rule of thumb is the longer it's been going on, the longer it's usually going to take. But also some post-operative procedures are timed, like a year to 18 months after the surgery. They can expect to have their full function back by then.
Now, how does one go about coming to see you guys here at IPT? I know there's a process.
There is a process, and unfortunately in the state of Indiana you have to have a doctor's referral. But also every patient has a right to go to any therapy provider that they want to. So the best thing to do is just to ask your physician to come to Indiana Physical Therapy. And
so regardless of if they have someone in their system, you can say, actually I'd prefer to go to IPT, and they can write you the script for that.
The individual, the patient has every right to go anywhere they want to.
So can you elaborate a little more on the treatment process, give people an idea of what they might be getting into?
Well, it is physical therapy, so it will be physical. We always tell somebody, the patient, to bring something comfortable to wear, or they can bring it with them depending on the type of weather. They're going to be doing some type of exercise, okay, whether that be on a stationary bike for the upper extremity or lower extremity. We're going to usually put our hands on them, do some type of manual therapy, whether that involves joint mobilizations, stretching, soft tissue massage. They're going to be using weights. We don't have an elaborate weight system because they're going to be weak. But we try to do as much functional exercise as we can. It's one of the reasons why we have a larger room, so that they can have spaces 15, 20 feet long where they can do some functional activities to get back to their normal daily routine, especially athletes, where we can do some functional agility drills in the clinic here, and we see how they're doing and see how they respond to it.
Wow, so it really is truly based on the patient.
Yes.
Obviously, an athlete is going to have a completely different set of exercises than perhaps someone who has had a fall.
Exactly, but just like the industrial person who's been hurt on the job, we call those the industrial athletes. Sometimes their rehab is harder just because they're doing it for 8 hours a day.
Wow.
5, 6 days a week. So sometimes that's harder than working with individual athletes. So
we
have to tailor their program to them. Someone who's climbing a ladder all day long, or climbing the sides of ditches, or shoveling all day long. We have to tailor that program to them too.
But at the end of the day, the goal is always the same, and that's to restore as much mobility and strength as possible.
Yep.
That's
yes,
great. And all they have to do is come to IPT and make that happen.
That's true.
That's
I'd love
great.
to see you.